Here's a hack that I use when I'm not sure what I'm feeling in the area. And it might seem really simple to you, but it's been 13 years of me doing adhesion release work on people who are suffering chronic pain, and I just recently started doing this. One of the principles of treating adhesion is you go to the proper depth, you sink down, and then you take tension horizontal to the tissue. Instead of taking tension on the tissue, all you're gonna do is take your depth and move the limb, and you're gonna feel stuff without taking tension. It might seem really obvious and simple, but I haven't been doing this. The foot is a really great area to practice this. Kim here has some chronic foot pain, and I'm not gonna treat her right now, but one of the big areas where people with chronic foot pain have stuff and adhesion is often along the first ray, along the flexor hallucis longus tendon, going to the first toe. And so if I take my thumb in here and I take some depth and I move her big toe, I'm not feeling much yet, but if I sink a little deeper and then I bring her big toe backwards, I'm feeling stuff pull under my finger. And I'm asking myself, given this amount of distance, how much is it pulling? Then I move my finger more proximal. How much is it pulling? How much is it pulling? And then I just move it a bunch of spots. I'm just moving her big toe 5 or 10 degrees, and I'm assessing how quickly does the tissue pull underneath my thumb. So now when I find a spot that pulls super, really severely tight with just a little bit of motion, guess what? You just found a horribly adhesed, gluey spot. And you know that you're gonna wanna treat that spot. Because if you ramp up that tension by extending her toe all the way and you feel just slide and tension for days, you know that that adhesion needs to go. And if you are taking your depth and applying tension without necessarily keeping your thumb soft enough so that you know what you're feeling, you might be completely blind and missing the fact that you're not even actually treating adhesion in the first place. So that's why if you're not sure that you're on an adhesed spot with somewhere like the foot, find the spot you think is bad, pull the toe a little bit, see how much it pulls, and then go to a bunch of different spots and ask yourself, which spot is pulling the tightest? Now you might have to be mindful of your depth, so you're at the proper depth level to feel what pulls tight. And after you practice this 20 times on patients, you're gonna be very comfortable doing it. But to help your mind, your bat sonar, grasp what you're feeling, how adhesion pulls really tight, really fast when you're moving somebody's limb, practice with the foot along the first ray, the first metatarsal, the first tarsal metatarsal phalangeal joint, and just find some spots and pull the big toe and see which spot pulls the tightest. Then when you find a spot that pulls super tight, like this pulls super tight, then I'm gonna sink in, take my depth, and then follow Adhesion Release Methods principle of tension, and I'm gonna go straight down, and then I'm gonna fully extend her toe, and she's got a massive amount of tension underneath my thumb as I'm creating tension and going down towards her heel. And now I'm just doing a treatment pass because I know without tension that I felt that this was a spot that pulled really bad and there was a really horrible adhesion there. So if you're not sure what you're feeling, take your depth and pull the limb, move stuff, allow things to slide, and find the area that pulls the most in a very short distance, and that is the worst adhesed spot. Hope this helps. Let us know in the comments.